Personally, I think health literacy is being one of the biggest problems in Gambia. A lot of people don't know what medications they're taking. To a point, they don't even know what disease state conditions they have, or they don't even know how to get little information about some of the things they really care about with regards to health, right? And I think this needs to change for a lot of Gambians so that we can have a better state with regards to our health outcomes. Coming from the Daily Dose Plus, I am Tijan Sinyan. I am your host for the Optimizing Health segment. With me, I have founder and CEO of Innovarx Global Health, Dr. Ismail Badjie. And then I also have Amara with me, who is a nurse intern at the Medical Research Council of the Gambia. Dr. Badjie, we can start with you. You can tell us a little bit about your expertise with regards to disease state management, health literacy, because I know you have a lot of information with regards to those areas.
No, thank you, Tijan. Congratulations on the show and to the whole Daily Dose. I think it's great. So as you mentioned, my name is Ismail Badjie, Gambian. I was born in Gambia, but haven't lived in Gambia. I am a pharmacist by profession. I guess chemistry is my background. First degree in chemistry. I have a doctor of pharmacy. All my practice has been in community pharmacy. So that handles disease state management, infectious disease, acute care, point of care testing, the whole 9 yards. So the first 10 years of my career, I was practicing in the USA. And now I run a healthcare solutions company in the Gambia, Innovarx, which is really just a community-oriented way of delivering primary healthcare in the Gambia. So looking forward to the conversation, yeah.
So Innovarx, obviously, a lot of people might know already. I was a part of Innovarx Global Health. That helped me understand a lot of differences or standards with regards to delivering healthcare internationally and in the Gambia, because I've had to be in health sectors like the normal health sectors that you would work in, the normal facilities and hospitals that you work around. And then I've also worked with Innovarx for several years. So I've seen the difference to what it means to deliver quality care with regards to what the normal standard should look like. But first, I would want us to dive into a little bit about how you think people should get information about health, right? How they should go to the doctors, how they could tell their problems, and how they should not leave the doctor's office without knowing what they're taking, what conditions they have. Technically, I would also want us to tell the people what the standards of walking into a hospital would look like to get proper care, right? Yeah.
Yeah, I think one of the biggest misunderstandings is the average Gambian African person doesn't understand healthcare and how it works. They often associate healthcare with a hospital. They often only have a relationship with healthcare in a time of crisis and emergency. So it shapes how we see healthcare only from that point in time where something is wrong. And especially then you have a male-female dynamic. Most females would interact with a health system more often and frequently than men, because traditionally men, it has to be burning, bleeding, or broken
Before you get
for them to
doctor.
seek care. So it starts with understanding what actually healthcare is on a backdrop of the Gambia, where the average age is 16 years old. How many 16-year-olds need a hospital unless they have an emergency, right? So that's where it begins, understanding that, okay, majority of our population are considered young, and typically youth comes with lack of conditions, right? So I tell people always look at healthcare from basically 3 lanes. Acute healthcare, meaning something is wrong, you need care now. It could be malaria, it could be an infection, it could be a motor vehicle accident, as in you need intervention now, right? Our health system it's not a health system, it's an emergency care system. Because the entire population runs to the hospitals, runs to the clinics after something is already wrong. But oftentimes something has been wrong for 20, 30 years, which is
to be honest, first time I've witnessed it, right? Because I can remember, I don't know if you still remember this. There's few years ago, before I started taking the vitamin D supplements, I always had weaknesses in my bone. But I always thought it was because I was doing a lot of activities, or it was stress, or you could always feel like, oh, I'm just tired. Maybe that is why. Until I got my vitamins D levels checked, and I realized it was too low, that my bones are already shaking, wanting to have more vitamin D, right? So what can we tell people?
No.
Most importantly, the youths, because I don't think it's about the older generation anymore. Because the older generation, like you said, they are already in that phase where they might need to go to the hospital regularly to check themselves. But the junior ones, we that are sitting at home thinking we are healthy, myself included, because I've not had my annual checkup this year, right? But what can we tell people my age, or how do you think we should be taking our health seriously? As in, what should be the steps, right?
Yeah. So a couple of things there, right? First of all, is information is critical. Most Black people think because we have a lot of sunlight, vitamin D is not a problem.
Yeah.
When our blackness, our melanin in itself, plays defense against our ability to produce vitamin D, right? Compared to somebody who doesn't have a lot of melanin. So part of it is information, right?
Yeah.
But most people, you just need to start your health journey. And I hate using, health is so holistic, right? There's emotional health, there's physical health, there's metabolic health, right? All those aspects of define health. So most young people may not have chronic conditions like diabetes or hypertension, but they may have issues when it comes to emotional health. They may have issues when it comes to physical health, because maybe they may be overweight, they may be underweight. So you switch from looking at healthcare from in case of emergency, and you start preventing. Because the moment you're born, you've started dying. From a healthcare standpoint.
Technically.
Right? The sooner you know what's going to kill you faster, the better.
The better.
Sometimes understanding who your father is, who your mother is, why did they die at 56?
Yeah.
Right? If it's diabetes in your family, diabetes is already in you.
It's going to come to you.
Right? If it's hypertension, hypertension is already in your family. Right? So you need to start playing defense against something that has a likelihood of killing you early. And oftentimes in a religious society, we don't like talking about death, but that's literally what it is. If you're diagnosed with diabetes or hypertension at 28 and you're not on the right medication, you're not getting checked, you're not going to live to be 80 years old. Right? So for young people, I start your health journey. That could be as simple as knowing your baseline things. What's in my family? That's where it begins, actually. What family do I come from? If my grandmothers are always dying from hypertension, if diabetes, my mom or dad has diabetes, it's not like maybe I might have it. No, though you're already at a risk
of having it. So more like now you're at a higher level of having it than
absolutely
somebody who does not have it in their family.
Absolutely.
And I don't think this is something that a lot of people have been considering, right? Because we have a lot of us at home who our grandmothers are gone already, right? Our sisters or aunties. Actually, it's gone to a point where you can literally be with the same mother and father with somebody, right? They already have diabetes, but you don't have it yet. But you don't care enough to know if you would have it, because you think, okay, maybe it skipped me, right?
And it's yet.
And maybe it's not just there yet.
Yeah.
So to what I understand is you're suggesting as youth, as adults, well, technically as anybody who wants to be healthy should have a proactive step towards trying to find out what could happen to you first, even before it happens.
Absolutely. And stop using the word youth, because you're technically a youth from 18 to 35. Right?
Right.
I was diagnosed with hypertension at 28. Now at Innovarx, we're seeing 21, 22, 23, 24, 25 get diabetes, get hypertension. So the moment you think these things are going to come when you're old, you may find out when you're old, but you've had hypertension for 20 years, right? So the idea of like, I'm too young, these diseases oftentimes don't care about being too young, because there's a lifestyle component to it. How much sugar are you eating in your diet? Do you have a healthy weight? Are you moving or exercising enough? All these things, you're playing defense. And you could do all those things and still end up with a chronic condition.
Yeah. So technically, if I understand, right, if I might have had diabetes since I was 15 years old, right, and if I don't find out
Maybe
till,
not that young.
yeah,
Unless
maybe
it's
not that young.
unless it's type 1
Type
diabetes.
1 diabetes. I'm just saying it with regards to age reference, right? But technically, if you don't know you've had diabetes or hypertension for, let's say, 5 years, and then you find out after 5 years, at that point, to my understanding, you've lost, let's say, 20% of your fighting chance already. Or maybe not.
No, not. It's capture and keep. The sooner you find out, in this day and age, people should not die from diabetes and hypertension because that's not what kills you.
Yeah.
High blood pressure doesn't kill you. Most people die of a stroke,
Yeah.
right? Diabetes is a metabolic dysfunction. Your body has lost the ability to process the amount of glucose, sugar that you're putting in your system, right? So that's not going to kill you. You're going to start turning blind. Your nervous system is going to start going bad. Your kidneys are going to start shutting down, right? So most people may die of end-stage renal disease or kidney disease, but diabetes led them to that path, right? So you could find out at 28 and it's been you for 2-3 years, right medication, right diet, right lifestyle, and you could combat it and keep it away, right? So it's that's the benefit of information now. You could actually control these diseases.
So in as much as information is important, I've just realized it directly ties to how well you're managing your disease as well.
Yep.
Right. So that brings disease state management into the fold. And when we're talking about disease state management, I also know we have the pharmacological aspect, we have the holistic aspect, and then we might have the nutritional aspect. Amara, I'm gonna come to you for you to tell us a little bit about the nutritional aspect. But before I get there, doctor has already told us the attitude we need to have in regards to finding out what diseases that we have, right? But also you have made mention that the care system in Gambia is more of a, now I have a problem, let me rush
And
to go
expect
get
a
it
miracle.
fixed, right? But also, like I've said before, right? I believe I've been in a two different world where I know the different standards of medication, of healthcare now, right? Because I've seen how it would have been delivered if it was the US, right? And not just because of my work with Innovarx Global Health, but if you look at healthcare documentaries, you look at some of the movies that they make on healthcare, you realize the whole process of how we handle things in Gambia or in our healthcare systems or structures or whatever is technically mediocre or would actually lead to more harm than it should, right? Because if you're sending a patient home, you're not telling them what exact medication they're taking and what they're taking it for, or how it might directly affect their kidney if they took it with something else, then it's more likely that you're sending them home to be bad than it shouldn't be. Right. I've realized that medications might have effect on your kidney because of the renal function test that I had to run when I was with you. But also, I want people to understand this on a micro level, right? How does you understanding what you have and the structures that you're going to seek help directly affects the outcome that is going to come from your disease state management?
That's a complicated question to answer, and I'll tell you why. Most African countries, the citizens are not contributing enough for us to have a good health system.
Exactly.
In the Gambia, you can sustain a health system paying $25 a year and expect $500 worth of care.
Okay.
That's one aspect. You cannot expect not caring about your part of health. Healthcare is a partnership between you and the state. The same way you have a carbon footprint where you minimize how much energy you're burning, you have a health footprint. You cannot ignore your health until you have end-stage renal disease and then rush to a health system that is overburdened, under-resourced, and still pay $25 to see a doctor, get a medical exam, leave with medication. That world does not exist.
Yeah.
And part of it too, who pays for healthcare? Most systems in the USA or modern societies, the government is the biggest payer for healthcare, but the government is able to do that because people are actually paying taxes, contributing to the society. We're not paying enough taxes, right? Because there's not a lot of employment. Most people don't have jobs to be able to pay taxes. The taxes could be sent towards healthcare then the health system improves. But also being that we're a young society, if every 16-year-old starts checking their blood pressure, exercises, which is free, stop drinking a lot of sugar, moderate tobacco, you're less likely to run into the hospital system, right? So it's always easy to see it based on where it is now and say it's bad.
Right.
But we're part of the reason why it's bad, because also we keep waiting for non-Africans to donate money to fix our health system when it's not a sustainable model, right? So there's a lot of issues to it, which is why in Gambia and Africa, your best safeguard is never needing a hospital.
Yeah.
And if you do things at home and in your life the right way, bearing motor vehicle accidents, which that is also it's a problem in the Gambia. Infectious disease, as Amara may know, Africans are not dying from infectious disease at the rates. Malaria is not killing Gambians at the rate that it used to, thanks to institutions like MRC.
Yeah.
People are dying from non-communicable diseases that they have contributed
To building.
Building, yeah.
Right? So it's a very nuanced conversation, but we have to be honest with ourselves. So our health system is not going to change overnight because we don't have a health system yet. We have an emergency care system that doesn't have enough money to give the healthcare providers the resources they need to practice at the top of their license. The only difference between private sector and public sector is Innovarx, our physicians could have electronic health record systems, they have point of care testing, they have continuous glucose monitoring, all the tools to do their job.
Right.
But the same doctor could be at a health system where resources are not available, the right medications. And you go from becoming a farmer who has all the tools to do their job to a farmer who they gave you a fork and knife and told you go till the soil.
So
That's literally
So technically, the harvest is where you know what is what.
It's resources.
But you've also mentioned that healthcare itself is a partnership, right? Between, let's say, us, the patients, or people who want to get better health-wise, people on the health journey, right? And then the institutions that provide those services, right? We know, as you've mentioned, our public places might have a lot of burdens, too many people rushing in, a less number of doctors, less number of nurses, resources as well, the number of beds or medications. But also, I think there is a problem with how we're doing some certain type of things in certain type of places, right? Because, for example, I know you can walk into a pharmacy in Gambia where they're not gonna give you a medication if you don't see a doctor who's gonna explain to you what that medication does, up to the point where what it could do to you, like the side effects. And I also know you're not gonna walk into IGH and you want proper care and you don't get your kidney function test or liver function test before they give you a medication, because you want to know if the kidney or liver at that moment could handle the strength of medication that you're going to give. But literally, you could walk into a public hospital and they just pick up anything like you're walking into an OTC place and then go back home without even knowing where you're going home with. So with regards to structures, right, what is the normal structure of healthcare? For example, if I was just gonna walk into a hospital in the United States, right, what would it look like? What would the process look like? If you walked into Innovarx, I think that's the same process. Because I've had people who've told me working there that they're getting the same amount of service in the US or even more here, right? So walking into a normal hospital in Gambia, because I know the differences, I see it more as hurting myself than actually seeking help. So we would also want to know a little bit as patients, what can we expect normally, or what should we expect,
Yeah, so I'm gonna repeat, your healthcare journey does not start at a hospital.
Yeah.
It may end at a hospital. And I really want to get Amara's take on that as well too, because she's a nurse, right?
Right.
And they're the pillars of the health system. We have to reorient how we see healthcare, because even a country like Gambia, the reality is we don't need a lot of hospitals.
We don't.
Who are we building a 500-bed hospital for when the average Gambian is 16 years old? What's the likelihood, right?
Yeah.
Our relationship with healthcare does not start at the hospital, right? So the moment you focus on the hospital, you're focusing on the end point. And the reality is, too, by the time you need a hospital in the Gambia,
You're already
9 times out of 10, you're not going to live 10 years longer.
Yeah.
Right?
Yeah.
We have to reorient that. Healthcare starts when you wake up every single day and you equip yourself with the most information to be able to assess your risk and take responsibility for your health. And that's why healthcare is not expensive.
Yeah.
It's expensive in a time of crisis and emergency.
yeah.
Right? So people tell you like, oh, healthcare is not expensive. People are spending money on entertainment. How could you walk around with a $75,000 phone in your hand and you can't pay $500 to get your blood pressure and blood sugar checked?
Exactly. Yeah.
Right? So I really want to hear what Amara has to say. As
So
well,
with
too.
Amara, I'm going to hit a little bit of a diverse because I think one of the benefits of Amara being here is, or one of the advantages is her just having to leave school and about to get into the professional world in a serious note, right? I know I've been to nursing school, so I know you have procedures that they teach you into the book. You know, when the patient comes in, you have to know the name, what medication, and all of that, right?
Yeah.
Which I think, if you would confirm, is part of the basis of things that they would tell you, right?
Yeah.
So why do you think people walk into the hospital and still don't even get to know what their allergies are before they go home?
Okay. Thank you. You know, I've come to realize that Africans, particularly in Gambia, they really don't care about health. People only go to hospital when they are dying or when it's serious or when the local native
Doctors'
medicine,
medications is not working.
is
That's
no
another
longer
problem.
working. That's why I've heard someone say that the major hospital is only for where people go and die, but they don't understand the fact that people go there when they're already giving up. If we can delete that attitude of going to hospital when it's really, really serious,
Yeah.
I think it can help. I've had a situation where, because I'm very particular about my health, I don't know, we as Nigerians generally, we're particular. I had the opportunity, thank God. If I go for clinicals, I check my BM, I check my BP, I check all those things. And sometimes one of my colleagues will be asking me, why are you always checking this? Nothing is wrong with you. Why are you always checking? I said, it's necessary to check. It's free. Why won't you check it? And you find out that it's generally the mentality of everyone. Probably if I'm not in the medical line, I won't be checking it because nothing is wrong with me. I don't have headache. I don't have any condition. So why am I going to the hospital? So it boils down to the fact that people only go to the hospital when it's serious. And if they're having that serious condition and they go to hospital, so far you can give them that medication or that therapy that can heal them at that moment. They don't care about any other thing. They don't really care they don't really care about the condition. Let me give you an instance. There's a case of a patient that came to the hospital. We checked her BP. The BP was high. And the doctor asked her if she's hypertensive. She said no. The doctor asked her if they have tested her BP before. She said yes, that they tested it somewhere else and they told her she had BP and they gave her antihypertensive medication. And they asked her if she took it. She said no, she didn't take it, that she got better and she left the drug. And she had to come back to the hospital when she was the BP was more than 200. So had it been the BP wasn't high, she wouldn't come back.
She wouldn't.
So generally, people go to hospital because the case is serious.
Okay, so I understand the fact where a lot of people are not getting the right treatment sometimes because of our attitude, right? Because we've already talked about the point where we don't necessarily have to go to the hospital only if we feel like we are in a state of emergency, right? We need to be a little bit proactive about that, right? So that also means us finding out what is wrong with us, how can we make sure something is not wrong with us? Pretty much knowing a little bit about your family and all of that. But also at some instance, Amara, I feel like some of these things are happening. For example, I wouldn't want to take 5 medications not knowing what the medications is doing to me. So preferably, if I was told that if I didn't take a blood pressure medication, my pressure was gonna get high up to a point where I could have stroke and die, right? I might have taken it a little bit more seriously. I think sometimes the problem also is people in the healthcare system don't give enough information to the patients, right?
I don't think so. Sorry to cut you short. Let's take, for instance, antiretroviral drugs. You see people that take it for some time and they stop taking it because they feel better. They feel they are healthy. They don't need it again. It's not because that the health workers didn't tell them to take it that will stop HIV from multiplying. It's because they are tired and they don't feel sick. So you wouldn't say that health workers do not explain in details.
No, okay. So the thing is, all right, go ahead, Dr.
And what I was about to say is, right, and I'm glad she used the antiretroviral
As an
example, because I tell people if I had to choose between diabetes and HIV in 2023, I'll choose HIV. It's one tablet a day.
a day, right?
It's easier to manage than diabetes.
Yeah.
Some people think I'm crazy, but yes, if I had to choose between HIV, being HIV positive, and having diabetes for the rest of my life, I'm going to choose HIV because I take one tablet a day and your viral loads are almost non-existent in this day and age, as long as you have access to medication. And I know this because I ran an HIV clinic in the USA.
Okay.
But what she says was so important. Oftentimes, when something goes wrong, the population points to blame the healthcare professionals. When sometimes the population abuse it.
That's why I also wanted to get an understanding, because I've been hearing people saying, "No, be mortality,
No.
But
What's the business model? Healthcare, medication, selling of medication. What is the business model? If whoever's selling it, like illicit drugs, they care about how much of it they could sell, if that's their business model, if that's their ethos. So anybody who comes, they don't care about your weight, they don't care about your kidney function. Their business model is to sell as much of this as possible.
Yeah.
If you put a healthcare professional whose business model is for you to be well, they're not worried about how many cups they could sell. They're worried about, why should I sell you this cup? And for how long should I leave this cup in your hands? Right? So you have to, it's very nuanced. That's why when people complain about the pharmacy sector in the Gambia, I understand. But majority of the people, their business model is not wellness. Their business model is commodity trading. So the drug becomes like a can of milk, a loaf of bread. How much of it can you sell? And if you live in a society where Gambia has 2.5 million people, there's not more than 40 pharmacists in the Gambia. Where in a place like the USA, if a doctor of pharmacy is not in a pharmacy, the business cannot open. So in the USA, even if my daughter is sick and I have to leave work, the entire community pharmacy closes down until another pharmacist is available to serve.
Because in the USA, they're thinking when a patient is taking a medication, you're supposed to see the doctor to tell you everything.
No, it's decentralized.
Okay.
As in, a doctor could write a medication, whatever medication they want. If I, as a doctor of pharmacy, don't see that this medication is fit for this patient, I decide whether or not they receive it.
I understand what you're saying, and now I've realized how much that is being a problem, which directly also ties to some of the reasons why some people don't like to go to the pharmacist or like to get checked, because they also feel like even if you get checked for let's say you have a headache, right? You might be dehydrated, right? I know you could also remedy that with other rehydration salts like ORS drink to make sure you're hydrated again, right? But most people would fear that if they walk into places, they're gonna give them 7 medications that technically has nothing to do with that. And that is where what you're saying plays a great role, because technically if I am dispensing something that has directly nothing to do with what the patient wants and there's nobody else to confirm if that is what they actually need, then that's where the business model comes into play.
Yeah, but who's at fault at that point?
So I guess, see, it comes back to the systems, right? It comes back to the systems.
No, not the systems. We are the systems. Right?
Yeah.
So I guess at this point, if we're not looking at the systems, it has to be every person who is in these places selling medications or talking to people or trying to help solve people's problem. They have to care enough not to just dash people things to go home with.
They have a customer. Any business, the moment you stop having customers, 2 things need to happen. Change your business model or you're out of business. The customers need to be educated. The Gambian people need to be educated.
Yeah.
Because one thing you notice, And with Innovarx, most people would consider as a elite or premium service, as in you have to have money to access them.
Yeah.
The moment money is not an issue, every consumer knows what's good and what's not good. And they want what's good. But even if we have a million pharmacies where nobody is there, a million clinics, the care is not good, they have customers. Until their customers start disappearing.
So, technically, if you look at it, right, because I've been angry about the systems, right? But when you put it all like this, right, I tend to learn that it's the customers that have to want better all the time.
Yeah,
right?
demand better.
Because if I know if I walk into these certain places, I might get medications that I don't need, or they're gonna sell me some things that I'm not gonna be comfortable with. I should rather just work to somewhere that I think I'm gonna get it better for.
And sometimes it's as simple as you bring a child to a place where medication is dispensed. And at any point did the person dispensing the medication to you ask you, how much does your child weigh?
Or how old is
When every medical professional knows that medications are dosed based on a child's weight, not age.
Based on the weight.
So if every consumer in the Gambia knows that, okay, you just try to sell me this without even finding out how much my child weighs, you are incompetent.
You don't care enough.
You don't have enough knowledge to let me know that, hey, if you take X amount of, acetaminophen or paracetamol, it may be difficult for the child's liver, right? If you take X amount of ibuprofen or Motrin, that affects the kidneys, right? That's the problem. That's why the education piece has to happen. We need to, and I think one thing is, as young people, we need to know how to channel our frustrations about what we think the system is when we are the system. A Gambian cannot complain about our health system, but anytime something's wrong, they go on Google and run to the closest pharmacy and start taking antibiotics when Amara will tell you.
Yeah.
Right? Or you tell somebody like, hey, I think you're hypertensive. And they tell you, no, I'm stressed. No, your BP is 160/95. That's not stress. That is hypertension, right?
Yeah.
So at that point, we tell them you have two options. Start treatment, and when you're on medication, you're not hypertensive, right? I take lisinopril every single day. I am not hypertensive. I'm hypertensive when I'm not on medication.
That's when the pleasure starts shooting up.
Right. Yeah. So we have to channel our frustrations a little bit better.
We do. Talking about all of this, we've talked about a lot with regards to what medications or how we should be taking them, all the advices that we should be getting. We've rolled around the pharmacy a little bit. So I would want us to also talk about the nutritional aspect, because I know sometimes how much we eat. Because I saw a post on What's on Gambia that said a woman went up countries and the whole community had hypertension because they had salt in their meal every day, right? I specifically know a high intake of salt or sugar might lead to these conditions, right? But I don't necessarily want to accept just salt is the reason why a whole neighborhood has, hypertension, right? So I think it necessarily has to tie to what we're eating on a daily basis, or what should we be eating, right? Before we go a little bit, Doctor, before you tell us a little bit more into the nutritional aspects of your expertise, Amara, I would want you to remind us, right, the community, a little bit about what the classes of foods are, and maybe tell us one class of food on each food class that would help us be healthier.
Okay. We have 6 classes of food. We have carbohydrates, we have protein, we have fats and oil, we have minerals, we have water. Then they have added fiber. And in carbohydrates, we have rice, we have tapalapa, we have semfo, which
that is what everybody is eating on a daily basis.
On a daily basis. Yeah. And on protein, we have beans, which is a high protein, highly nutritious.
Right.
But it's not popular.
It's not.
Even in Nigeria, it's not popular.
Yeah.
But it's highly nutritious. And we have fats. We have saturated fats, which we eat mostly, which is not healthy.
It's not.
We have unsaturated fats, which is healthy, mostly plant fats like vegetable oil. Yeah. Then we have minerals like calcium, which you can get from milk. We can get from liver. We can get from eggs. We can get from bones. Then we have water and fiber. Fiber like wheat, cornflakes, Cerelac, nuts, almond nuts, and so on and so forth. And water. Water is very important.
Yeah.
Water is very important.
I have you jump into the water bit, doctor, because I know a lot of people complain about how much it's hot in Gambia on a daily basis, right? If you go on social media, everybody's complaining. They can be for over tanga, naturally for gainer. But I also know readily, including myself, not a lot of us drink a lot of water, right? What would be the recommended dose of water on a daily basis, or what? I think on a level, we also have to understand what water does to our system, how important it is to our nutrition, right? And also help us just tell us the balance where nutrition and pharmacology meets with regards to these estate managements.
Yeah, so water, I mean, we're made up of water, right? Most people are dehydrated on a daily basis. Because if you're not consuming, they tell you about 1 to 2 liters of water.
A day.
And that's if you're not engaged in strenuous activity, if you're not working outside, if you're not in a hot environment. So most people is actually more. And people don't realize how difficult it is to consume 2 liters of water. And I always challenge people, just try it. Buy 2 liters of water in the morning and just walk around with it and see. But it'll do 2 things. You'll feel better, right? Because you're in homeostasis, as in you have enough water in your system. You're not going to eat as much food. It's going to help with digestion. Most people, even before you eat a meal, you're supposed to have a glass of warm water, not cold water, before you start eating, because it helps digestion. And it's going to make sure no matter how hungry you are, if you start with a glass of water and then you start eating, you're going to eat less.
Right.
So you need water. And so the moment you're not taking 1 to 2 liters of water, and then some people are adding a couple of things that make it worse. Coffee, right? A natural diuretic. Most people consume a lot of caffeine. Right?
A lot of people.
Sugar, right? The basic chemistry is the more salt you consume, the more sugar you consume, you need to overcompensate with water. So most people, this cup of coffee, which I had with no sugar, no milk, they'll put so much sugar in it that they are already putting themselves at a risk of dehydration, right? But also our elders, they don't drink a lot of water sometimes because they don't want to keep having to perform ablution
When they have
all
to
the
go
time
pray.
because they have to go
Yeah.
pray. So they are minimizing the amount of water that they're consuming in the day. And if they come from a privileged background, when they're eating, instead of giving them water, they're giving them baobab with sugar, wanja with sugar, ginger with sugar.
Juice.
So oftentimes the people that we love the most, we actually kill them faster based on what we feed them. And even as somebody who's trained, I've studied everything about medication, right? I could tell you food is the more potent drug than medications. If you control what you eat, it will help your health more than what medications will do for you. But as the human race, even sugar, our bodies are not designed to have access to as much sugar as we do now. And majority of people in the Gambia, and people when you say sugar, they think white sugar. It's just the worst form of sugar. Rice is sugar. Tapalapa is sugar. Cornflakes is sugar. Anything that has a carbohydrate is going to end up as glucose. The only difference is how fast does it get into your system as glucose, right? So I worry more about, I think sugar is a bigger problem than salt. The only thing about salt is genetically, us black people, our body holds on to salt more than any race in the world, right? So think about basic science.
Yeah.
Anytime where there's more salt, what happens to water? Your body tries to hold on to as much water as possible. So you have fluid retention. What happens when you have too much water in your body? Your blood pressure goes up, right? So that's why they tell people salt is bad for you when you have hypertension, because it increases your water retention, because now your body needs more water than it needed. So everything I just said, think about it with somebody who drinks half a liter of water a day, right?
Yeah.
These things are, there's life hacks to health
There
when it
is.
comes to nutrition,
Right.
right? So most people, like you said, healthcare professionals, once you figured out nutrition, you need more protein than you need more carbohydrates most of the times.
Yeah.
At night, what are you eating carbohydrates for? Are you running a marathon at night?
No.
You're not, right? But look at the
People at night, we eat a big bowl of mala in the night.
No,
That's how it rolls in
Gambia,
Gambia.
we have a carbohydrate diet. That's why even you'll see somebody who doesn't have muscle but has a big belly,
Belly.
right? Because we don't eat enough protein. We don't eat enough. Breakfast, bread, carbohydrates. Lunch, rice, carbohydrates. Dinner, even if you sub it out for chura, gedda, manor, it's carbohydrates, right?
Yeah.
But nobody's consuming enough protein because we don't do a lot of beans. People don't have money as much to eat chicken, fish, and beef because poverty also plays a role.
Beans is affordable.
Absolutely, right? So there's so many factors, but medicine is food is more powerful than medication.
Medication is. Well, I know everybody on the internet says, how do you call it? Money before 6 abs and all of that. But I think we've been looking at it on the wrong way, right? Because technically, from what Dr. Badjie is saying, I've had medical information before. Like, I've learned medicine or nursing a little bit. So I would have thought I knew what it meant being healthy, right? To the point where the salt, I never knew that is what exactly would have happened. Right? But also, I just realized what I'm eating is, if I'm eating more carbohydrates, it's going to be difficult for me to get 6 packs and my belly is going to be a pot belly.
Yeah, but you don't even need 6 packs.
Right.
It's not efficient. It's nice aesthetically. You don't want to have a lot of abdominal fat because men tend to store fat as a form of evolutionary survival in their stomach because your body thinks famine is coming. So let me convert as much sugar, glucose, into fat. But most men who are not healthy, the bigger your stomach is, you have risk for conditions, erectile dysfunction, diabetes, hypertension, right? Because you're affecting blood flow, right? So that's the part. Abs is, you just need to be in a healthy fat range. And that's why women will always have more body fat than men, even on the same age, because women need it for survival more. So they store fat in their legs, in their breasts, in their hip. They have more areas that they store fat for survival. But it's because of their reproductive system. That's why most professional athletes, the moment you drop below a body percent fat for a female, you lose your period.
Oh, wow.
You lose your ability to conceive because your body doesn't have the body composition to bear a child. So most professional athletes goes years sometimes without having a period because their body. So it's so much intricacies to it.
So until you have these conversations like this, you're not gonna realize how much just nutrition itself and a little bit of caring about your health a little bit has to play with technically your whole life.
Yeah.
Because if it's what you're eating, what you're putting into your system, how often you're checking yourself or how often you're exercising controls how you're going to live your life or how healthy you'll be or where you can go or not. I think more focus should be put on that. I'll swing back to Amara a little bit just for her to advise us on a little bit about nutrition. How can we get a little bit more healthy as humans?
Eating balanced diet is very important, and being particular about what you eat. Most times when we're all hungry, including myself, whatever you see you buy, you eat because you're hungry. You don't really bother about the nutritional content. But it's very important for us to focus on what we eat, especially proteins and vitamins, which is, I'm not saying that carbohydrate is not important. It's important because it's energy giving diet.
But I think, well, rightfully, but it is as important as any other class of food, right?
Yeah.
But I think the timing and what you're eating is what really matters.
Yeah,
Because
exactly.
Dr. Badjie said a point where at 8 p.m. in the night, if you're eating, just to wait a little bit, like an hour after an hour to
running?
go to
Yeah.
bed. Why are you eating carbohydrates when you're not going to run a marathon?
Yes,
So you don't
exactly.
need the energy. You only
Yes.
need to eat at the moment of the time, right? So yeah, that point is known now, I guess.
So you find out that people eat more of carbohydrates in the morning, as you said, afternoon and night. I think most of us are guilty of this, including health professionals. So, and some people find it, think or believe that balanced diet is expensive. It's, if you ask me, it's not.
Yeah.
Because there are things you can get from the market that is very affordable,
Yeah.
like beans. I always
You love
emphasize on
beans. Don't you love beans?
Funny enough, when I was younger, I didn't like beans. But I came to realize as an adult that beans is very important. It's really very, very important, especially for children, for growing children.
And people with diabetes, because anytime you eat protein, it doesn't spike your blood sugar.
So that's
Yeah.
also eating hard,
Right.
right?
It's a life hack.
It's a life
And even fruit juices. Eat a natural fruit and drink water. Your body will make the juice for you in your
Yes.
stomach. Because then you have the fiber,
Yeah.
you have the slow release carbohydrate.
Carbohydrate.
So it won't spike your blood
Blood
sugar.
sugar faster, yeah.
But honestly, what we do with fruit juices, baobab doesn't need sugar. It's naturally sweet. It has so many antioxidants. It's rich in potassium. It helps with dehydration. Just mix baobab with water and you're good to go. You don't need sugar.
Exactly.
Right.
Your body doesn't need all the sugar. Coca-Cola, Fanta, Sprite, they should be illegal
See,
from a healthcare standpoint. No, they actually should be.
yeah.
Before you know the damage of one can of Coke, one can of Sprite, one can of Fanta, wear like a continuous glucose monitor, or just, even if you have it, check your sugar right before you drink a can of Coke. Drink the can of Coke. In less than 20 minutes, check your blood sugar.
Yeah.
And I think it has to be worse because Coke has saturated sugar.
No, it's the worst kind of sugar. If somebody is about to go unconscious because their blood sugar
it's
is
going
low,
low. Yeah.
Yeah.
you give them half a can of Coke.
They'll be good.
And it puts so much glucose in their
their
system.
system.
But think about the wealthier we are, breakfast,
Coke, juice,
lunch,
baobab with sugar.
dinner, right?
Yeah.
So even Ramadan, which that's why a lot of people, that's dangerous, because between iftar and in the morning, you're consuming so much sugar
Sugar.
and so much calories that you're sicker.
Then your system cannot even get rid of before the next time you start
Yeah.
eating sugar like
And
that.
then you're not sleeping long enough, right? So there's a lot of components. And I think one thing, since you mentioned young people, I have to mention that they may not be worried about diabetes, hypertension, but even if you're sexually active and you're young, you should be getting STD testing
Exactly.
as frequent as possible.
Yeah.
Anytime you change a sexual partner, you should be getting an STD test. Minimum once a year, you should be checking for HIV, for hepatitis, right?
Yeah.
But most people in the Gambia, you could see people who've been sexually active for years, and you ask them, when was the last time you got tested? They don't know.
They don't know.
And the men are worse. And the thing is, most of the STDs, a woman manifests the symptoms faster. So men could carry STDs and be asymptomatic for so long, and they're just community spreaders at that point.
They just giving
They're just spreading. But that, I think, for young Gambians, mental health, you have to focus on that. Sexual health, you have to focus on that. The rest is just preventative,
Yeah.
right?
Yeah.
But as you transition, if you transition, you get married, you transition from a monogamous, a polygamous, or whatever situationship that people define it, where you have one sexual partner, then maybe the frequency of STD testing is not important. Right?
Right.
But even most women, it puts them at a disadvantage, but because you could have chronic conditions where just because you didn't get tested, you could be carrying hepatitis for so long, and you take that into your marriage. Because also most young people get married and they don't do STD testing.
Yeah.
They don't talk about family
They
history.
don't talk about genetics.
So those are just some of the things where, especially with us, we're a young company, we have a lot of young people. That's why we focus on, sexual health. We focus on mental health, but still encourage. But you can't talk about healthcare, especially in the Gambia, because of our sutura culture, our denial culture, our male patriarchy culture, the stigma culture.
Yeah.
Young people need to start getting tested for STDs.
STDs. So, well, young people, that was the line. Young people need to start getting tested for STDs.
Yeah.
But I think from the whole conversation, I think everybody should understand from now that it does not matter what age you are or how healthy you think you are or you look, right? The first thing that you should be always doing is trying to find out what could go wrong with you and how to make sure you remedy them. You know, your nutrition should be on point. You have to go get your STI test. You know, it does not matter. Even if you have one partner, you're not sure if your partner is not sleeping with somebody else because we've got to that point in life now, right? So it's always important to get all of those tests done. And like Dr. Badjie said, he gave us an example where in this day of age, he would choose HIV over diabetes
diabetes.
because he knows it's easier to control HIV than it would be easier to control diabetes. It's so sad that half of our population, or I would think a majority of our people here right now already are struggling with diabetes and don't even know the right way to deal with it. Right.
4 out of 10 Gambians
4 out of
that
10.
we screen. And we've screened over 10,000 Gambians since we started because, as you know, we always provide free blood pressure screening, free blood sugar screening, free body composition
What's
screening.
your number?
4 out of 10 Gambians that we screen have abnormal blood pressure or abnormal blood sugar. That's 40%.
Of Gambia.
And sometimes as young as in their 20s, right? So it's not even we think this is a problem. No, we know most people are going to die early because of chronic conditions, right?
So yeah, that brings up the point where if you just want to live a healthy life or if you just want to be better, including us who think we love people at home, our elderly ones, that we're making every meal for them tailored but also in the worst way possible. We've been giving them juice, giving them too much sugar, not even caring how much water they're drinking. You know, I think it's got to a point where we have to even talk to our parents and be like, I know you want to pray straight 5 times without having to go do this and that, but you cannot not pray. You cannot not drink water just because you want to pray and then kill yourself in the... It's more like suicide. I don't think even religion accepts that, right?
It is, though. Most people's relationship with food is suicidal.
Yeah. And
It's just slow.
there's no way religion would accept suicide. So
It's just
so
slow.
we need to put religion aside. We need to put some of these things, especially us that always think everything about health is always expensive, or you just don't want people finding out about what is wrong with you. I think it's come to a point where if it's survival and people knowing stuff about me, I'll pick survival any day, right?
Yeah, but
But also, you have places in Gambia that you can walk into, get tested, get medications, get doctor's advice on everything without even the people in the hospital knowing you've been there. Because technically, if you leverage the telehealth that you're talking about, you don't even need to walk into the hospital, right?
Yeah. But it's limited.
It's limited.
It is limited.
Limited.
Right.
We need to create more awareness.
Yeah.
And more testing centers, make it easier for the young ones. Because there are people that will want to test, but they don't know where to go.
Where to go.
That's true. And you know the reality is, these conditions don't care how you feel about them. They're not going anywhere. You have an STD, you're worried about stigma. That STD is not going anywhere.
It's only gonna
You
get
have
worse.
hypertension, you have diabetes. You be in denial all you want. It's just going to destroy your body slowly. So most people, those are your options. And I think as healthcare professionals, especially Amara is going to be the future of healthcare.
Amara?
By God's grace.
Our healthcare professionals need to be honest with how we communicate with patients.
Yeah.
There's no maslaha. If you have a condition, we need to start telling people you have 2 options. Get on the right medication, get frequently tested, have a life chance of living longer. You don't. You could go to any traditional healthcare system you have. There's nothing wrong with some of them, but sometimes they're problematic. You're gonna die early. So if patients understand there's 2 lanes, like the Matrix, the red pill or the blue pill, right? It changes the conversation.
Yeah.
Right? And oftentimes, nothing against our traditional healers is, but when it doesn't work, or an emergency happens, then all of a sudden these people have an epiphany and believe in modern medicine again and run to the hospital.
Yeah.
When your life battery is already at
It's
3%.
already, yeah.
So it's just those 2 things. It's not that simple. Nobody's God. Everybody knows when you're going to be born and die. But scientifically, we know what certain things are going to lead to early death, which is why the average Gambian we have less than 2%. About 2.4% of our population that are older than 65 years old. That's one of the worst in the world. Only 0.1% of our population gets to celebrate 80 years old. The average Gambian man dies in their 50s. So think about what that does in our culture, where most men are the breadwinners. They've stifled opportunities for women in their family. They've stifled opportunities for their wives. And most men like to marry young. So you get married to a woman who's 15 years younger than you. And you die at 55. So she is 40 years old with 3 kids and she's a widow. And you didn't plan your life because the death was unexpected. You didn't have an inheritance plan. You didn't transfer wealth. You didn't build businesses that could transfer. So you die early for something that you could have prevented, and you leave your entire family to live a lifetime of poverty.
And sufferation.
Right?
Pretty much.
That's the Gambian and the African story.
Yeah.
Right? So we have more widows who are not even 50 years old.
Exactly.
And it leads to poverty because the woman, the children, literally their whole lives are upended because of a man was spent his whole life chasing money and status in society to die early without a plan.
Well, this puts a lot of things onto the table, right? Because if you keep talking about some of these things, it's never going to finish, right?
Yeah.
You only need to have a positive attitude towards some of these things, right? But as we're coming to the end of this episode, I would want Amara just to give us a little bit of advice and also your closing remarks, and then we'll have Dr. do the same.
Okay. I want to say something about stigmatization.
Go ahead.
I would say we should stop with the stigmatization because even you that is avoiding somebody or stigmatizing a person, you don't know your status. You don't even know if you have it. So we should encourage people. We should be able to support one another. We are all Africans. We only have each other. And we should try to live healthy, even though it's difficult. It is difficult in this economy for someone to eat balanced diet or to be particular about their food or their health. But we should try. And we should pray. We should drink water every day.
2 liters plus.
Every day, as the doctor said.
Right. 2 liters plus.
Yeah. And avoid, depression is key in this in Africa generally. Before I think people were saying that suicide is a white man's, or this depression is a white man's disease. But now it's in Africa. You find people being depressed for a very long time. They put up the show for social media, they are okay, but inside they are dying. So we should be kind to one another.
Right.
Everyone is going through something.
She has a point that she said, you the person stigmatizing, or it could have been me. It could be in a jovial manner too, right? But you don't know how the next person is going to process or take that stigmatization at the time, right? Which could also lead to depression, which could lead to suicide. As she rightfully said, us Africans, everything, we try to think we're stronger, right? Or we think things cannot get to us, right? And that's where that's a whole different topic on mental health, right? But the stigmatization is one problem. You can ruin somebody's life just by talking to them a certain type of way about their condition, right? And it's as important about as if people fear knowing what is wrong with them because of how they think society is going to perceive them, they are never going to find out, right? And then, like Dr. Badjie said, for us men, because I would say men, what that does is it just leaves our family prone to suffer when we pass, because you've seen what the statute of limitation is with regards to time and living and being healthy, right? So I think everybody should just focus more on their health more now, and then forget about the stigmatizations. You know, be proactive, go get checked, and all of that. So we'll also have you, Dr. Badjie. Now that we know what is best, right? We've always known, I think, at some level, you always know what care should look like. Because when you're getting something properly, you know how it feels, right? So, but now I would say again, now that we know what the problems are, some of the problems, and then along the sides we're talking about some of the solutions are how to fix them, right? We also, what would you think should be some of the facts or the closing topics that we should be looking at as humans with regards to just better health?
I think, like a lot of things in life, the first conversation you should have is with yourself. I think every young person, every adult person should be able to do an internal health assessment to know, because healthcare is not a cookie cutter solution. What wellness means to Amara, what wellness means to you, what wellness means to me is different. My mom had hypertension. She has diabetes. I'm a healthcare professional. I had hypertension at 28 years old. I know so much about the condition that anybody who knows me, I know how to live my life, right? Have a conversation with yourself to assess where you are. It removes the barrier of thinking so and so will judge me, and just start your health journey. And I think as young people, as Gambians, it's not healthy how we keep pointing fingers at what's wrong in our system without fixing our system, right? And it that's why most of our problems are not solved in this country, because we channel frustrations in the wrong way without being honest with ourselves as well too. And as young people, one of the core things you need to have is self-awareness anyways, to see what are my health habits, right? What is my current situation? And take charge of that, because then you're going to play defense against never needing something. And Gambia has an opportunity to be one of the healthiest countries in Africa.
Yeah.
Because the average age in Africa is 18, but the average age in Gambia is 16. Right? So if half of our population is young and everybody takes an internal switch
Self-commitment.
to healthcare, then our hospitals are not going to be full 20 years later, right? So it just starts with, and seek information from the right places. It's encouraging to see a lot of Africans getting into healthcare from a private sector standpoint or public sector, because healthcare is a human interaction, right? That's why if you're a Black person and you go to the USA, for example, you can't receive the same level of care than what our nurses at Innovarx will provide to Gambians, because in them we see our mothers, in them we see our fathers, we see our sisters, right? But it's not doom and gloom. I'm more optimistic in terms of where healthcare is going. And the more companies that are young, innovative, we're less stigmatizing, we democratize access and care. So everybody will do their part, and I think we'll be in a better situation. But it starts with self, like a lot of things. It starts with self.
Well, you've had what we had to discuss on the platform, and then I'll do a brush, just a little bit of I think what we've discussed, more to my understanding, right? We know there's a lot of problems with regards to healthcare. We know there's a lot of things that are not going right, but if the good doctor and Amara has teach us anything throughout the show, is that us as a person is the system, right? So we have to be proactive. We have to know. We have to be committed to regards to health with ourselves, right? We have to know where we are, right? If we're gonna go dehydrated, we have to know the amount of water we need to drink. We have to know where to go get medical advice. Technically, we also have to know who is selling us the medication. So if you walk somewhere and they're giving you medications without asking for your child's weight, and they're asking, well, technically sometimes they wouldn't even ask for age. But anyways, if you're walking somewhere, they don't care enough to ask for your child's health, or not care enough to specifically tell you what a medication would directly do to you, as a person, I think you should just know that's not the best place you're gonna get care, and then you move. But also comes to the systems, it also comes to all of us, not having to go to the hospital only when we're sick, not taking care of our elderlies and treating them special by just giving them juice instead of giving them water to drink. So technically everything, right? A lot of people have problems with regards to what religion is and what health is, but if you are willing to grow, right? Like I said earlier on, if you think you're cutting out on yourself because of religion just to go get hurt in your health journey, technically, I don't think religion would advise that. So all we should do is try to be self-aware, know what informations we're getting, what medications we might be drinking, what food we should be eating, what time it is, and what the substitutes could have been, But to be honest, we cannot discuss everything on the show. So Dr. Badjie's handle is gonna be on the screen. Likewise, you can always run through Innovarx Global Health.
Get a free screening.
Go get a free screening. You can get your blood pressure or blood sugar screening checked for free.
And STD testing. We're rolling out our Sutura screening. That's what we're calling it, Sutura screening. Come get your STD testing done. If you don't want to come to our facility, we'll come to your home, invite your kids, invite your family members, your significant others as well too. So that's something exciting.
One other winning thing I can tell you is you can always send a message to the Daily Dose Plus too if you just want to know some of these things. We'll either put you in touch with Dr. Badjie, or even Amara will be on standby to give you advices, But thank you for joining us today. This is the Daily Dose Plus. I am Tijan Sinyan, your host for the Optimizing Health segment.
Thank you, guys.
Thank you guys.